Hello, I am Dr. Bishas. I am a doctor of this clinic. I confirm that you are Mr. Darren Chris, 40 year.
Yes, doctor.
Okay. I have came to know that you have weakness for last 2 months. Is it right?
Yes, doctor. Yes.
So can you please tell me more details about that?
Yes, doctor. For the last 2 months, actually, I think that I have been feeling more and more weak. Okay. And I think I get tired whenever I do want to do work whenever I want to do work. And this is actually, I don't feel well now. And I also have, I think that I have lost a bit weight. Okay. Uh, so, and so this is actually troubling me, doctor.
I'm sorry to hear that. And can you please tell me that where do you feel weakness? All over the body or
I
just?
think all over the body, doctor.
And you mean weakness that is a lack of energy?
Yes, doctor, lack of energy.
And did it start suddenly or gradually?
I think, doctor, it's gradually, doctor.
And do you think it is increasing?
Doctor, I think it's increasing.
Do you feel any specific time of the day when you feel the weakness or all the time?
There is no specific timing, doctor. I think I feel weak whenever I want to do work. I feel weak.
And anything, have you noticed that anything brings your condition notes?
Actually, whenever I want to start doing something like I want to get up, okay, and so want to, and then try to go to a place. At that time, I feel more weak, doctor.
Can you give me an example for your weakness?
Oh, well, actually, I think sometimes I have some dizziness also when I want to get up, okay, from standing position. That's all. And at times I also feel weak. How can I describe that, doctor? I feel tired and weak.
Tired all the time or just when you try to stand from the sitting position?
At that time, at times I feel dizzy, but I think I'm feeling tired more, almost many a times a day.
And when you do any job, you feel the tiredness.
Yeah.
And can you tell me that how severe is this condition?
Not very severe, it bit irritating, doctor.
And along with it, you said that you have lost a few kg weight.
I think so. I haven't measured it, but I think that
Okay. And
might have lost.
any other symptom do you have?
No,
Any headache?
no,
Any changes in your vision?
I haven't noticed, doctor.
Any rash anywhere in your body?
Not rash, doctor, but I think that I have some color, blackish color nowadays.
And which part?
I think over my mouth and also over my hands.
And for how long?
For 2 to 3 months, doctor.
And is it increasing?
I think so, doctor. I'm not quite sure. I think so.
Any ulcer in your mouth or anywhere?
No, doctor. No, ulcer, sorry. What you told, doctor? Ulcer. I think, doctor, I don't know, but I have some pain in my mouth, I think.
Okay, I'm going to look into that later. And do you have any chest pain?
No.
Any cough?
No.
Any shortness of breath?
No.
How about your bowel work?
Quite good, doctor.
Water work?
Good.
Okay. Do you have any lump anywhere in your body?
Not that I know.
Any weakness?
Doctor, I'm weak, doctor.
Any site of a specific site of your body?
No.
Do you have any past medical condition?
Not that I know of. No, doctor.
Do you take any medication?
No.
Any of your family member have this type of condition?
Well, when I told my mother, he told that my father had this type of condition.
And was he diagnosed with any condition or anything?
No, doctor. He wasn't diagnosed.
Okay. Can I examine you and take your history at this time?
Yes, doctor.
Can you show me your hair? You said that you have some problem in your mouth. Can you show me your mouth?
Yes.
Okay, you have some rash over your mouth. Is it painful?
Yes, doctor.
Okay. I'm going to see your hands, okay?
Yes.
To see your pulse, and I can see that your hands have somewhat. Is your skin thick? Have you noticed any changes in your skin?
I haven't noticed, doctor. Actually, I don't know.
Okay.
Might be.
Any pain in your hands?
No, doctor.
Okay. And I think that there are some pigmented spots.
Okay.
Okay. And may I know that I want to know this blood pressure at this point.
Okay. It's 110/70.
And postural draw.
I think it's 90/60.
Okay. And you would like to see if this anemia.
Mildly anemic.
Okay. And after that, I want to see the tummy if there is palpate the abdomen. Okay.
Okay.
I want to see for any lumps. Okay. 2 minutes remaining.
Yes. Okay.
Okay. And at this time, I am going to listen your back. Please take deep breathing and out through your mouth.
Okay. It's quite okay.
Okay. And may I know that do you drink alcohol?
No, doctor.
And do you smoke cigarette?
No.
Okay, that is fine. May I know that what is your concern?
Well, doctor, what's happening with myself?
Okay. And one thing I want to ask before I answer the question, that do you have any fever or night sweats?
No, doctor.
Okay. As I have taken your history and examined you, I think that you are suffering from a condition we call it Addison's disease. That is
Mm.
most likely affecting
Mm.
a hormone or a body product that is producing less than normal. So it cannot
Okay.
maintain the body's blood pressure and cannot maintain the body's
Mm.
work level stress, so that you are having this weakness and also you feel the dizziness.
Okay.
And for this, I need to run some blood tests, some imaging tests, and after that, I can give you the best explanation that what is happening with you. Okay.
Okay.
And I think I can manage you on outpatient department, outpatient basis, and I am going to involve the doctors from hormone doctors and some other, and also I am going to involve my consultant and your GP for your further evaluation. Okay.
Okay, doctor. Okay. Well, may I know, doctor, what about my problem in the mouth?
Okay. Actually, you have a rash in your mouth for that, and I need to know very personal question if you don't mind.
Yes, doctor.
Okay. Do you have any partner?
Yes, doctor.
And is he male or female?
The female doctor.
And any casual relationship?
No, doctor. What are you asking, doctor? No casual relationship.
Okay, time up.
Okay. Okay. So, what do you think your diagnosis is?
Okay, I think this patient is suffering from Addison's disease, and this can be related with uh, or autoimmune polyglandular syndrome, and most likely type 1. And I need
Oh,
to run, I have some also other differentials that it can be a presentation of HIV, and
mm,
so it can be okay.
mm.
And also it can be a presentation of autoimmune, other autoimmune. Okay, I cannot remember much.
Okay, that's all right. That's all right. And how would you like to investigate the patient?
Okay, I'll go for the complete blood count to see anemia and white blood cell count to see the level is raised or not, white blood cell
Mm,
count to the level raised or not, then inflammatory markers, CSR and CRP. And after that, I will go for the renal function test, especially some electrolytes with
mm,
which I expected to be hyponatremia and hyperkalemia, and I also go for
mm,
the serum calcium level, which I expected to be raised. And after that, I will also go for the urinary electrolytes level, and after that, I will go for the serum cortisol level, and then short synectin test and long synectin test, and also
mm,
urinary cortisol level. And after that, I will go for the imaging test, like ultrasonogram of the liver, sorry, ultrasonogram of the abdomen with CT
mm,
scan of the adrenal gland, and and also X-ray test, and with some special test like 20 on high alpha hydroxylase antibody level. Then I can also go for the genetic study.
Okay. Okay. And how would you manage the patient?
First, I will educate and counseling the patient, and as I am suspecting this is a case of autoimmune condition, I will also involve the endocrinologist, and also after I will also involve the genetic counselor,
Mm.
and also I will involve the physiotherapist.
Okay. Okay. So actually, thank you, doctor. You have done very well. Okay. So actually, you have actually covered more or less all issues. So just that question, I think you should have asked in the history part, that is exposure history, because that could have been a because you ruled out malignancy by lumps, TB, and also associated uh, autoimmune by asking about bowel problems. Okay, about anemia. This can also be. I told that mild anemic. He didn't have bowel problem, but it might be associated with pernicious celiac disease. Okay, oral candidiasis, and also I think primary hyperparathyroidism can be also be involved, as long as I can remember. Am I right?
Yes,
Yeah. So all
hypoparathyroid or in autoimmune condition.
yeah. You ruled out those, but I think if it had been a case of HIV, then you would have missed the case.
Yes, I forgot asking the, as this patient has oral candidiasis, so I should have asked about the
Yes, because it was actually, although I refuted the claim of exposure history, but if I had told it, then you would have completely missed the case, and I think the examiner would have cut down some marks for it, significant
yes,
marks.
and
Okay.
also I should have taken if I had time, I should have taken other history, any injectable drugs and any
Yeah,
blood
yeah,
transfusion history, any tattoo.
yeah. So I think this was this was well done, but this if it had been HIV, then it could have been a disaster for you.
Yes, yes.
Okay, so you can move on to the next case.
Can I start?
Yes,
Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
yes. I'm Dylan McDermott, 62 years.
Okay, Mister. I got a letter from your GP saying that you have low back pain for last 6 months. Is it right?
Yes, doctor.
So can you please tell me in more details what has happened to you?
Well, doctor, actually, for the last 6 months, I have been suffering from some problem, doctor. I think that it started very gradually. I had some pain in my back. At the beginning, I didn't consider it seriously, but as the days are progressing, doctor, I think it's gradually increasing. And uh, although I'm a retired person now, but I want to take my grandchildren from and to school actually, and due to this pain, I think I am getting a bit hampered.
I'm sorry to hear that. And can you please show me the exact site where do you feel the pain?
I think, doctor, it's exactly in the back, in the lower back.
And mid side, midline, or just side?
It's midline, doctor. It's midline.
Okay. And you said it is started gradually and it is progressing nowadays. Okay.
Yes, doctor.
And,
Yes,
do you feel the pain every day?
doctor. Almost every day, doctor. Now,
Can you please say me that how do you feel the pain? Or what was the feeling of your pain?
doctor, it's quite, at the beginning it was dull aching, but nowadays I think it's getting a bit severe. Although it's aching, dull aching, but I think it's getting
Is
more
it the
irritating.
first time or you have this before?
No, doctor, in the last 6 months, doctor.
Have you got any injury to your back before that?
No, doctor, no injury.
Okay. Does this pain go anywhere?
No, doctor.
Okay. Along with this pain, have you noticed any redness or swelling over the area?
No, doctor. No redness or no fatigue.
Any weakness in any of your legs?
No, doctor.
Any changes in the sensation of your legs?
No sensation change, doctor.
Any problem with your bowel habit?
I've not noticed, doctor. I've not noticed.
Okay, and have you noticed any changes in your water work?
Oh yes, doctor. That's another thing issue. I think. That's another issue. I think that I have to go more frequently for my water work for the last 1 year, doctor. And recently, I also have noticed that I have some frothiness while doing my water work.
Okay, and have you need to wake up at night?
Yes, doctor. At times, I have need to wake up at night nowadays.
Okay, and do you feel any incomplete evacuation after passing your water?
I don't feel any, doctor.
And how frequently you have to wake up at night?
Uh, Once or twice, not every night. At times,
How about your thirst?
I think it is increased, doctor.
Okay, and I am coming to your back pain, and after that I'm going that later. Okay, and
And since you told about back pain, I also would like to tell that at times I feel also some tummy pain. Okay, in my groin region. Not always. Not along with back pain, it does not spread to that side. But at times I feel some separate pain in my tummy, in the groin region.
okay, and have you noticed that anything makes your tummy pain worse or better?
I haven't noticed, doctor.
Okay, and for your back pain, do you feel pain at night?
Doctor, actually, I think I feel the pain almost all the time, more or less. Okay. But it's usually a bit more when I do some work. And at night, after getting up, I think I feel a bit relaxed.
Okay, and any morning jamming have you noticed?
Doctor, very not significant, doctor. I haven't noticed significant.
Okay, and after that, have you ever noticed anything that makes your back pain worse or better?
No, doctor.
Just
I have tried with some
working makes it worse,
painkiller, but it didn't work.
and working makes your pain more worse.
I think it's. I think so.
And can you please tell me that how much severe your pain, where you to say that 1 is the least pain and 10 is the highest pain you have
I think
referred?
it's 5 to 6.
And do you have any past medical condition?
No, doctor.
Okay. And do you have any headache?
No, doctor.
Any changes in your vision?
No,
Any reaction in your body?
no.
Any cough or shortness of breath?
Oh, doctor, that's I don't know whether it's related or not, but I think that recently I am facing more chest infections. In the last 2 years, I think I have had 6 to 7 chest infections, but I didn't have this type of infections before. Okay.
Have you seek any medical attention for that?
No, doctor, I didn't seek any about that.
Any test was done for your chest infection?
Sorry.
Any test?
No, doctor. Actually, I take some medication from our local pharmacy, and it actually goes away.
Have
Not
you
just,
ever coughed?
no. Cough, I sometimes I cough, but there is nothing comes out. Right.
Okay. And can you tell me more about your weight? Have you noticed any changes in your weight?
Yeah. I think doctor, my clothes are getting looser day by day.
Yeah, I'm sorry to hear that. And how about your appetite?
Okay, I think it's quite right.
Okay. And okay, I am going for. Do you have any lumps or bumps anywhere in your body?
No, doctor.
Okay. And may I know that do you take any medication?
Doctor, I take some medication for this pain reduction, but I don't think it works.
Okay. And at this point, may I know that do you any of your family member have this type of condition?
No, doctor.
Any history of cancer in your family?
I don't know.
Okay. And is it okay if I examine you now?
Yes, doctor.
Okay, I want to see your hands for any signs of rheumatological condition, and at the time I want to measure the pulse
Pulse, it's quite okay.
and blood pressure.
Okay.
Then I want to see the eyes if there is any anemia.
Anemic.
Okay, and at this time I want to listen your back. Okay.
Yeah.
Uh,
No, nothing abnormality present.
okay, and at this time I want to see your tummy if there is any lumps is present or not.
No lumps.
And may I see your back?
Yeah, you can see.
Okay, any swelling,
No swelling.
any tenderness over the spine?
Some mild tenderness in the lumbar region.
Okay, and at this time, can you show me how you walk?
Walking is quite normal.
Okay, 2 minutes remaining. Okay, at this time, can I examine your legs for a plantar reflex?
Yeah. Plantar is normal. Reflex is normal.
Okay, and sensation, I want to see the sensation if you can.
Yes, it is quite okay.
Okay, and I need to examine at this point, do the digital rectal examination, and also need to need.
Prostate is normal in the digital rectal examination.
Okay, and at this point, may I know that do you smoke cigarette?
No,
And do you drink alcohol?
no, doctor.
And may I know that what is your concern?
Well, doctor, what's happening with me? I'm very worried.
Okay, as I have taken your history, it seems likely that you might have some fracture in the bone of your spine. Okay, and
Okay.
sometimes I think that it can also be related to your cyst infection that you have suffering from recurrent cyst infection.
Okay.
For this, I need to run some test urgently, and after the test results come, I can make an appointment with you, and after the results come, I will make an appointment.
Okay. Okay, doctor. Okay.
And
Uh, well,
any other question?
is it anything serious, doctor?
Uh, I afraid to say that it might be something serious, but we need to run some tests first.
Okay. Okay, doctor. Thank you.
Okay.
So, I think the time's up.
Yes.
So, what's your diagnosis in the patient?
Okay. For this gentleman, my I have few differentials that it can be a osteoporotic fracture. Sorry, it can be a metastasis in the spine due to carcinoma of the lung or due to carcinoma of the prostate. And then it can also be a case of discitis that is associated with his history of recurrent cyst infection.
Mm.
I also consider that this can be a case of osteoporotic fracture.
Okay. Uh, can you relate that? Okay, that the patient has anemia. Okay, I
Yes.
told it. The patient has some frothiness in the urine and increased frequency of urine. Okay, and he also has some tummy pain. Okay, so can you please relate that? Can it be relatable? Tummy pain in the groin region.
Yes, it can. We also that sometimes it can be a case of which is related with hypercalcemia. That is hypercalcemia causing pain in the groin or any ureter or renal.
Okay, and can you please can you relate that hypercalcemia causing weight loss, recurrent chest infections, and low back pain?
Actually, for recurrent cyst infection, I am suspecting that this can be a case of carcinoma of the lung that is producing parathyroid hormone like uh,
Okay,
products that
okay.
is causing hypercalcemia.
Can you okay, that's all. That's all right. I can accept it. Can you think about multiple myeloma? This
Yes,
patient.
multiple myeloma can also
Yes,
multiple
multiple
myeloma is
myeloma
like
has
I forgot.
paraproteinemia. Okay,
I
so
forget.
paraproteinemia. In case of paraproteinemia, there is functional immunoglobulin deficiency. Okay, so when there is functional immunoglobulin deficiency, there can be repeated chest infection, and it can also be a presentation in multiple myeloma. And usually, that renal involvement, I told that actually this is for around 1 year. Usually renal involvement a lot of times can occur previous, okay, in multiple myeloma, okay, as long as I know. And usually after we start that bortezomib, that Velcade therapy in multiple myeloma, it improves drastically this renal function, okay.
Yes.
And yes, so that can be important. And the patient can also suffer from normocytic normochromic anemia. That is also important. Actually, I gave all clues there for hypercalcemia.
Yes,
And when you
I totally forgot the multiple myeloma.
okay, and actually, when you told about specifically about lung symptoms, I actually clearly told that no, nothing comes out or nothing like that. Okay, so that it could have been clearer, but okay, that's all right. Now, can you what you have told, that's not wrong. They are also correct. Now, can you please tell me what investigations would you like to do?
Okay, for this gentleman, I will go for the complete blood count to see anemia and white blood cell count level if they are increased or not. Then the inflammatory markers. Then renal function test like serum urea, electrolytes, and serum creatinine, and including serum calcium levels, serum phosphate level, and serum thyroid hormone levels. And after that, I will also go for the X-ray of lumbosacral spine and also MRI of the lumbosacral spine. And along with it, I will go for the ultrasonogram study of the prostate. And after that, and also I will go for urine for routine examination with especially seeing for the Benson's protein and serum immunoglobulin levels.
Okay, serum and urine protein electrophoresis. Okay.
Yes.
And bone marrow test for looking for monoclonal plasma cells.
Plasma cells. Yes.
Okay, and in this patient, there might not be. I'm not sure whether it's detailed in detail in textbook, but immunoglobulin levels should also be checked. Okay, in this multiple myeloma patient. Okay.
Okay.
And okay, and how would you like to treat the patient?
Yeah, first educating and counseling the patient. Then it is a multidisciplinary approach. I will involve the rheumatologist, and also I will involve the physiotherapist, and also I will involve the multidisciplinary team with GP for his follow-up, and also I will involve the nephrologist.
Okay, okay. Do you want to give anything for bone protection?
Okay, if professional health therapist, if it is a risk of any weight bearing ACE or any weight bearing of.
Okay, can you think of a bisphosphonates?
Yes, for treatment, there are certain treatments like calcium replacement, and also going for the.
There are some protocols also, and you will actually involve the blood doctor, the bone doctor, all the protocols. Okay.
Okay.
Okay, so I think that was well, but I think you should have got the case. Okay.
Yes, it was a big, huge mistake that not adding, not thinking about multiple myeloma. I totally it went out of my mind that there is a condition named multiple myeloma.
Yeah, no. Actually, what happened when I study also, I already think that okay, metastasis. But many a times I just forget about multiple myeloma. I myself do this thing. We rule out all other symptoms to check the primary source of of cancer, but most of the times we miss that. But I actually very clearly told you that there is polyuria symptoms, and actually
Yes,
for
yes,
lung cancer, it should be squamous if there is hypercalcemia feature,
yes,
and it's actually there would have been, I think, quite hemoptysis or these features would have been present, I think. Okay.
yes. This
Yeah,
was
so
actually a totally clear case, but I missed because I I I was out of my
yeah.
mind.
But okay, it's all right. But I